Welcome to the deep dive. Today, we're taking a really fascinating look, I think, into how we view the living brain.
Hmm.
Specifically, we're exploring SPECT brain function imaging and how it connects with hyperbaric oxygen therapy, HBOT.
Exactly. And for you listening, the really key thing to get right off the bat is um, we're talking about technology that lets us see the brain in action.
Mhm.
SPECT, that stands for single photon emission computed tomography. It uses a very tiny amount of an injected radiopharmaceutical,
Okay.
and that lets us evaluate brain activity right down really at the cellular level. Think of it as showing how much energy different bits of the brain are actually using.
Right. So it's different from, say, a CT or an MRI scan people might have had, because those show us the structure, don't they? Like incredibly detailed pictures of what the brain looks like.
Exactly, the anatomy.
But SPECT, it's showing us what's actually happening inside those structures, how well they're functioning.
That's it. It's not just about whether everything is physically, there.
Mm-hmm.
It's about how actively it's working. And that, for you listening, that could be a really, really important piece of the puzzle, especially for understanding certain neurological conditions.
Because it can show problems even when those standard scans, the anatomical ones, look completely normal.
Precisely.
Yeah.
That's often where it shines. So our goal today, our mission, if you like, is to explore just that.
Oh.
How this SPECT imaging actually works to give us this functional view, what it tells us about the brain,
Yeah.
healthy or otherwise.
Uh-huh.
And importantly, how it helps us understand the potential of hyperbaric oxygen therapy for, a whole range of neurological challenges. We're drawing on some really insightful bits from a paper that digs deep into this exact topic.
Okay, sounds good. Let's unpack that first part then. How does SPECT actually give us this picture of brain function? How does the magic happen, so to speak?
Well, it starts with that injection we mentioned, the intravenous injection of a radiopharmaceutical. Now, this is a specially designed substance, and it gets taken up by active brain cells.
Mm.
And it does this based on their metabolic needs, basically, how much glucose and oxygen they're gobbling up.
So the harder a brain cell is working, the more of this stuff it absorbs.
That's a really good way to put it, yeah. The busy parts drink up more.
Okay.
Then you have the SPECT scanner itself. It's designed to detect the very faint signals, the emissions, coming from that radiopharmaceutical inside the brain.
Right.
And then specialized software takes all this raw data and processes it. It creates these detailed 2D and 3D functional images.
Functional images, yeah.
And what's also really valuable, I think, is that it gives semi-quantitative information. Meaning it doesn't just give us, pretty pictures. It actually provides measurements of activity levels in different brain regions.
So you can compare, like before and after therapy.
Exactly. It allows for more objective comparisons over time, which is critical.
And you mentioned this isn't just about blood flow, right? Because some scans look at that. That's a key difference here.
It is a key difference.
Yeah.
While blood flow is absolutely essential for the brain to work, SPECT is thought to directly reflect the metabolic activity of the neurons themselves,
Okay.
not just whether blood vessels are present or blocked like you'd see in, say, an angiogram.
Gotcha.
So if an area isn't taking up much of that radiopharmaceutical, it suggests those neurons, they aren't functioning optimally, they're underperforming.
And this seems really important from the paper. Underperforming doesn't necessarily mean dead or permanently damaged, right?
That's the really interesting point the paper makes. These underperforming, or you could call them idling neurons,
Mm-hmm.
they might not be gone for good.
So they could potentially be recoverable.
That's the potential hope, yes. They could be revived, perhaps with therapies like HBOT.
Wow. Okay. That is a powerful idea. It shifts the perspective, doesn't it? From just looking for irreversible damage to looking for areas we might be able to help.
Absolutely. It's about finding potential for recovery.
So in what kinds of situations, then, would a doctor think, okay, let's use SPECT here? What are the main reasons?
Well, the paper outlines a few key ones. First, it gives you a visual document, like actual proof of neurological disorders, and shows where the function is reduced. You can literally see the less active areas.
Okay, visual evidence.
Second, it's really useful for identifying dysfunction that's happening in multiple brain areas.
Yeah.
What we call multifocal dysfunction.
Right.
And this can come from all sorts of things. Problems with blood vessels, inflammation, maybe a head injury, or even exposure to toxins.
So it's like seeing multiple smaller problems instead of maybe just one big one.
Exactly. It helps map out the extent of the issue. And thirdly, SPECT can sometimes uncover other conditions, comorbidities, that weren't even suspected based on the main symptoms.
Like what? Give me an example.
Well, say someone comes in after a concussion, a TBI. The SPECT might show the expected pattern for that, but it might also show patterns linked to, say, PTSD or perhaps past exposure to some neurotoxic chemical.
Ah, so it adds layers to the diagnosis, provides a much fuller picture than just the initial reason for the scan.
Precisely. It helps understand the whole person, really.
Now, we've kind of touched on this, but let's be really clear. Why might the standard scans, CT and MRI, miss these things? What are their limitations?
Yeah, it really comes down to scale and what they're designed to detect. CT and MRI are brilliant at showing structure, macroscopic structure,
Big picture stuff.
right? Tumors, significant damage from a big stroke, large areas of swelling or bleeding, things you can physically see as an anatomical change. But lots of diseases, lots of functional problems, they start much smaller. They start at the cellular level.
Before you can see a lump or a hole.
Exactly. Long before millions and millions of cells are affected enough to cause a change that's visible on a structural scan, like a lesion or some distortion.
So by the time something does show up clearly on a CT or MRI, the functional issue might have been going on for quite a while, undetected.
That's often the case, yes. The paper really hammers this home. SPECT is just way more sensitive for picking up these earlier cellular level functional abnormalities.
Because it's measuring the activity, not just looking at the structure.
Exactly, how well it's working, not just how it looks.
Okay, that makes perfect sense. So we see SPECT revealing things CT and MRI might miss. Now let's connect this directly to hyperbaric oxygen therapy, HBOT.
Right.
What specific conditions does the paper talk about where SPECT is used in evaluating patients for HBOT?
The paper lists quite a few clinical areas where SPECT comes into play, either when considering HBOT or monitoring its effects. These include things like cerebral palsy, stroke, or CVA, concussion, and other traumatic brain injuries.
PBI.
Exposure to various neurotoxic substances could be environmental, could be from medical treatments, even recreational drugs.
Wow, broad range there.
Yeah. And also, interestingly, in evaluating atypical brain function patterns seen in conditions like autism spectrum disorders, ASD, or pervasive developmental disorders, PDD.
So for autism, it's not necessarily looking for damage, but for different patterns of activity.
Exactly. Evaluating how the brain is functioning differently, you might say.
And the paper mentions that people with these conditions often have a complex mix of symptoms, right? It's not always straightforward.
Yes, absolutely. And that's where SPECT can be really valuable. By showing these regional patterns of function or dysfunction, it can help clarify if there are multiple underlying issues feeding into that complex clinical picture a patient presents with.
Right.
The authors even suggest that looking at these atypical brain function patterns with SPECT can help guide therapy choices, maybe point towards treatments beyond just what the standard diagnostic label might suggest.
That makes a lot of sense. If you can actually see which specific brain areas aren't firing on all cylinders, you can maybe tailor the treatment like HBOT more effectively?
Potentially, yes. That's the idea.
The paper also includes a case study, doesn't it? A young woman with a traumatic brain injury. That sounds like a really concrete example.
It is, and it's quite compelling. This was a 20-year-old woman. She had a pretty severe injury, a laceration of her right middle cerebral artery.
Ouch. Okay.
Now, what's really notable, and unfortunately common, as the paper points out, is the delay. It was 2 years after her injury that she had a SPECT scan done in connection with starting HBOT.
2 years. Wow. And initially, the main visible problem was weakness on her left side, right, which makes sense with a right-sided brain injury.
Exactly, the left hemiparesis. And her initial SPECT scan confirmed what you'd expect. A focal area, basically a dead zone, showing absent function where that artery supplied blood. That matched her physical weakness.
Okay.
But here's the crucial part. The SPECT scan also showed reduced function bilaterally in her frontal lobes and her temporal lobes.
Wait, so areas that weren't directly hit by the initial artery damage?
Correct. These were areas showing dysfunction, likely due to the overall trauma or secondary effects, but not direct tissue death from the laceration.
And that explained other things.
It explained a whole host of other problems she was having. Things that weren't maybe getting as much attention initially, like she couldn't drive anymore, she had trouble expressing emotions, couldn't keep up with her studies, couldn't hold a job.
The executive function stuff, emotional regulation, things tied to frontal and temporal lobes.
Precisely. These were huge impacts on her quality of life, but maybe less obvious than the physical weakness. The SPECT brought them to light.
So the scan gave a much more complete picture of the total impact of her injury. What happened when she did the HBOT?
Right, so she had 40 sessions of hyperbaric oxygen therapy. They did a follow-up SPECT scan afterwards.
Tan.
Well, as you might predict, that initial dead zone, the area of non-viable tissue, no significant improvement there. That tissue was likely gone.
Okay, makes sense.
But the scan showed clear improvement in function in multiple other areas of her cortex, including those frontal and temporal lobe areas that were underperforming before.
Wow. So the HBOT seemed to help the struggling areas, even if it couldn't fix the area that was too far gone.
That's exactly what the scans suggested. And clinically, this lined up perfectly. She showed improvements in her executive functions, better concentration, better decision-making, more emotional awareness and expression.
That's incredible. And did she continue with HBOT?
Yes, her journey didn't stop there. She actually went on to have over 100 sessions in total.
Okay.
And over the following months, the clinical improvement was really significant. She got those executive functions back, started driving again, went back to college,
No way.
earned her degree.
Mm.
Essentially, apart from some lingering weakness on her left side, she got back to a near normal life.
That is just a fantastic outcome.
It really is. And the key takeaway from the paper's perspective is how SPECT revealed the full extent of the dysfunction, not just the obvious hole, but the wider network impact.
Right, which led to a better understanding and seemingly a more effective extended therapy approach with the HBOT.
Exactly. It guided the process and helped explain the recovery potential beyond just the initial focal injury.
Such a powerful illustration. Now, the paper also mentions something else. Areas showing unusually high activity. Hyperperfusion. What's that about?
Yeah, that's another interesting finding they discuss. In some people, especially kids and young adults, the SPECT scans sometimes show cortical areas with this increased metabolic activity or hyperperfusion.
So, too much activity, almost.
Kind of. The paper suggests these hyperperfused spots might indicate potential epileptogenic foci.
Meaning areas prone to starting seizures?
Potentially, yes.
Yeah.
Regions that could be irritable or unstable. And interestingly, some doctors noticed that these individuals sometimes showed a temporary increase in hyperactivity during the middle part of their HBOT course.
Huh. That seems counterintuitive. You'd think the oxygen therapy would calm things down.
It does seem a bit odd, doesn't it? But because of this observation, this correlation between hyperperfusion on SPECT and temporary hyperactivity during HBOT, some practitioners started considering using anticonvulsant medications before starting HBOT in these specific patients, sort of as a precaution.
Ah, okay. So the SPEC isn't just spotting low function. It can also flag potential overactivity that might need managing alongside the HBOT.
Exactly. It adds another layer of information for planning the treatment.
What about frequency? How often are these scans typically done? You wouldn't want to do them constantly, I imagine.
No, definitely not. The paper suggests the frequency really depends on the clinical situation. It's often used when standard CT or MRI scans are normal, but the patient still has significant symptoms.
Right.
So you might do a baseline SPECT before starting a therapy like HBOT.
Right.
Then follow-up scans might be considered. Perhaps if more therapy is planned, even if the patient seems better clinically, just to see the objective change. Or, conversely, if there hasn't been much improvement, to see if anything has changed on the functional level.
Makes sense.
But generally, because it involves a radiopharmaceutical, the paper mentions typically no more than 3 SPECT brain function scans per year.
Okay. And just to reiterate a point from the outline, the radiation dose, say for a child, is actually quite a bit lower than a CT scan, right?
Yes, that's an important point. For a 10-year-old, the radiation exposure from SPECT is significantly less than from a typical head CT.
Good to know. Okay, so as we kind of pull this all together, what are the big picture conclusions from the paper, the main takeaways about SPECT's role?
I think the paper really frames SPECT as a tool for looking at regional cellular level function. It helps base therapies on the underlying physiology of what's going wrong.
Right, getting to the root cause.
Yeah. And they stress it's not experimental, it's an established clinical technology, been around for nearly 30 years.
Okay.
A huge point is that the modern software lets us see this cellular dysfunction before anatomical changes show up. That makes it more sensitive than CT or MRI for catching things early.
Seeing the smoke before the fire, in a way?
That's a good analogy. The paper also highlights its power to uncover things that might be clinically silent or hidden.
Like
Maybe silent seizure activity, evidence of old TDIs or PTSD you didn't know about. temporal lobe issues that might respond well to HBOT and could be impacting language in kids with ASD.
Interesting connection there.
Yeah, or cerebellar dysfunction affecting sensory integration, again, maybe improvable with HBOT.
Yeah.
It can even sometimes show why someone isn't responding to other therapies.
So it can solve diagnostic puzzles.
It can definitely help. And finally, the authors really underscore that SPECT often reveals multiple co-occurring issues, comorbidities in pretty much every patient they scan.
Really? Multiple things going on.
Almost always, they suggest, which gives a much deeper, more nuanced insight into all the factors, behavioral, anatomical, physiological, that are contributing to the person's overall struggles.
Okay, so summing up then, it really sounds like SPECT brain function imaging provides this unique, valuable window. It lets us see the living brain working or not working at that cellular level in a way that standard anatomical scans just might miss entirely. And this information seems incredibly important for truly understanding complex conditions,
Right.
and also for guiding and checking the effectiveness of therapies like hyperbaric oxygen.
Absolutely. And I think for you listening, the key thing to take away is that there are these advanced tools like SPECT that can dig deeper. They can uncover hidden aspects of how your brain is functioning.
Or a loved one's brain.
Or a loved one's brain, yes. And that knowledge has the potential to lead to more personalized treatment plans, more effective strategies, especially when the standard pictures don't tell the whole story.
This has been genuinely illuminating, really fascinating stuff. It does make you wonder, doesn't it?
What's that?
Well, if so many neurological problems do start with these subtle functional changes at the cellular level, way before we see structural damage, how different would things be?
You mean if we used functional imaging more widely earlier?
Yeah. How might earlier, more widespread use of something like SPECT completely change how we diagnose and treat brain disorders? It's definitely a powerful thought to leave folks with.
It certainly is a potential paradigm shift.
Thanks for taking this deep dive with us today.